Welcome to NMA. In this whiteboard session, we will map out the step-by-step process of how a liver abscess forms. Stick with me, and in just a few minutes, you'll understand the entire story, from the first invading bacterium to the formed abscess. Liver abscess is a localized collection of pus in the liver caused by infection. Two categories of liver abscess have been identified. Amoebic liver abscess, which is the most common, caused by Entamoeba histolytica, often associated with poor sanitation. And the pyogenic liver abscess, which is much less common and caused by bacteria, E. coli, Streptococcus, Klebsiella. Here we discuss the step-by-step process of how a liver abscess forms. Liver abscesses often arise from infections elsewhere in the gastrointestinal tract, such as appendicitis and diverticulitis, or biliary tract, such as cholangitis, which is a bile duct infection. Bacteria from these sites can travel to the liver via blood vessels. For example, an ascending infection from bile ducts, most common in obstructive biliary disease. Similarly, through the portal vein from intra-abdominal infections such as appendicitis and diverticulitis. Also from bloodstream infections such as sepsis and endocarditis. And rarely from nearby infected organs through a lymphatic system. Bacteria produce enzymes or toxins that cause hepatocyte death and trigger inflammation. The dead liver tissue forms a necrotic core, which the immune system tries to wall off. So, white blood cells, mainly neutrophils, infiltrate to fight bacteria, releasing enzymes that liquefy necrotic tissue. Liquefied necrotic liver cells along with the dead and alive bacteria and the dead neutrophils leads to the formation of abscess cavity. The wall of the abscess is formed by fibroblasts and inflammatory cells, attempting to contain infection. Finally, a localized, pus-filled cavity within the liver parenchyma results. A patient with liver abscess will have the following clinical symptoms: nausea, vomiting, anorexia, malaise, fever with chills and diaphoresis, weight loss, dull abdominal pain and tenderness in the right upper quadrant. Patient may also have hepatomegaly, jaundice, and anemia. So, let's tie it all together. A liver abscess begins with an infection. Infection spreads, bacteria invade, necrosis occurs, followed by an inflammation resulting in a pus-filled abscess. For now, you have a solid grasp of the pathophysiology. Thanks for sketching it out with me on NMA. If this helped, please share it with a fellow student. See you in the next video.